That was the first time I felt black in the healthcare system. Because I'm like, I got good insurance. I have my parents, great insurance. I got Blue Cross Blue Shield PPO as an adult. It is no reason I'm getting misdiagnosed. My care team is at Northwestern and Chicago. So I had an oncologist at some other hospital and hated them. She was a white woman who walked into the room, didn't read my chart, didn't read anything about me, and said, oh, you're not having a period, so you're not bleeding, it's PCOS. And I was like, excuse me, I have cancer. And so I fired her right after. I stayed, as a black woman, I think sometimes we are often labeled as like aggressive or being argumentative or, having too many questions. And so I politely finished the entire doctor's appointment. And after that, I said, yeah, this is done. We're done here. And ended up getting a recommendation for a second opinion at Northwestern, and they are the best ever. And Dr. Emma Barber became my oncologist. Now, what was interesting about that journey to Northwestern was the woman that was my oncologist was like, nothing is really wrong, we'll put you on birth control to control your cancer. And it seemed a little weird because I'm like, why would birth control cancer? But with endometrial cancer, which is uterine cancer, so I'll use those terms interchangeably. And so sometimes it can be hormonal. And so they do often prescribe you birth control to see if it's a hormonal, if your cancer can respond to that. I didn't know from March up until maybe, I saw her maybe April. April to September is when I got my new oncologist, and my cancer had spread. And she was like, actually, the birth control isn't responding to your cancer at all. And so that was a moment where my mom was with me. We got called into this little small room, it's like office space. And she was like, did your other oncologist tell you that your cancer is spreading to your muscles? She's like, are you tired often? I was like, I take naps like 4 times a day. She was like, well, your cancer is spreading. You have a tumor growing out your cervix. And my mom and I were like, and so with cancer patients, I'm on the cancer board actually at Northwestern. And so me doing a lot of patient advocacy now, looking on the other side, you disassociate. Because I'm like, girl, what you talking about? My mom, though, was very present in that moment, and she heard everything she said because I was like, it sounds okay. It sounds crazy, but sure. So we get into the small room, and she goes over a plan. Shall we go to a treatment plan? And I was like, well, for what? I got stage 1, I'm okay. And she was like, you need to freeze your eggs if you want to have children. We have another surgery because we need to remove the tumor. And so from September of 2022 up until January 2023, I had 4 more surgeries, a stroke, radiation. This past year, I had like some heart attack symptoms because going through radiation, I'm in menopause now at 30. So, yeah. I have PTSD that I've had prior to cancer, which is post-traumatic stress disorder. I've been pre-exposed to a lot of trauma, back to back to back. And so I always use this thing that cancer wasn't the camel, but it was the straw that brought the camel's back, right? And so I had this stroke December of 2022. So maybe it was right before Christmas or right after Christmas. I was in the hospital. And I was at work at the time, and I couldn't feel one side of my body. And turns out I had a brain disorder stemming from stress. And they were like, we know you're going through cancer, but also now you have functional neurological disorder, which means that my brain and my body are not connected, but it comes from this extreme amounts of just stress. And so radiation was March of last year. That lasted about a month. And radiation caused my ovaries to burn, which was also unexpected because they were like, you're gonna have all these symptoms, like you're still on a period, but you don't get a period, the hysterectomy. And I was like, well, I'm not getting any of those, but I'm really, really hot all the time. And so then a normal level of estrogen in someone's body at my age is like 70 to 90%. I was at 7% when they found out I had menopause. And so this after cancer has also been not just during, but this learning what your body is like now post-cancer is also something that is a path or a journey in itself. I didn't get all the information. Also, so in between the March to September, I had another surgery at U Chicago to also see if we can alleviate some more, to scrape some of the cancer cells off. That did not work. As a patient advocate now, it's interesting to say because you do everything that you're supposed to do. And some people, healthcare, Black women, Black people, it's a big health disparity when it comes to healthcare. That is a known fact. It is a very common theme that is not, it's not a fairy tale, right? So what was interesting to me was, so my parents, I grew up in a military family, right? My mom works in the federal government. My stepfather works with task force for CPD and the FBI, right? So this sounds really crazy, and I'm gonna say it is the truth. That was the first time I felt Black in the healthcare system. Because I'm like, I got good insurance. I have my parents' great insurance. I got Blue Cross Blue Shield PPO as an adult. It is no reason I'm getting misdiagnosed. And I was like, oh, I'm Black. Because you didn't hear me. I went to my menopause doctor, and she was like, had you not come to us, you would have not saw your 30th birthday. My oncologist called me before my 29th birthday, maybe 5 weeks before, and was like, your cancer is spreading. Can I take your case to a team of oncologists at Harvard or something like that? I can't remember exactly. I said, sure. She said, because I don't want to do hysterectomy on someone who is this young and you don't have biological children. I did IVF, so I froze my eggs. One of my surgeries I had went from maybe one tumor, then removing 3, didn't even know. My doctor didn't even know it was 3 tumors at the time. And yeah, so from a patient perspective, I did everything I was supposed to do. I don't think that you can advise anyone to not do what they think is best for them. But what I will say is if you don't feel that no one's hearing you, don't stay. You don't have to. Because had I stayed where I was at, I wouldn't be sitting here talking to you all right now. To hear, you might not make it to your 30th birthday. Then she called me back after she went to her conference. So Northwestern, most people don't know this, is very world renowned for their cancer care. People from all over the world come to their oncologists. And she was like, every oncologist that I talked to said, your only hope for living is hysterectomy. And that was last January.